Welkin empowers health organizations to deliver patient-centered care. Welkin is purpose-built specifically for healthcare organizations. Some key differences you'll see from other tools used for patient management are configurability, patient centricity, extensibility, and workflow automation that enables more human caregiving. In this video, we'll focus on Welkin's care delivery portal, where the diabetes education and care team would spend their time. As a certified diabetes educator providing blood glucose and insulin pump device support, I start each day by logging into Welkin's care delivery portal. I land in my inbox, which is a collection of personalized tasks I need to complete today. They keep me focused on what I need to do for my patients, whether I've assigned them for myself, or they've come from my team, or automation rules and triggers. They're grouped by categories that are unique to our program, patients, and the type of care we need to deliver. The inbox categories and additional information that is displayed was configured by our program director so that I have an at-a-glance summary that helps me understand what I need to accomplish. It's 10:15 a.m., which means it is time for my coaching session with Peter Lopez. When I click on their name, I'm taken to their patient profile. All the members of our team, dietitians, care coordinators, CDEs, that engage with Peter are centered around this profile. It contains information from systems that are integrated with Welkin, like an EHR or a blood glucose meter, assessments the patient fills out, inputted information from other people, and a full history of our interactions with Peter. It also contains prompts which guide me through my work, such as schedule appointment prompt above Peter's timeline. Before I start my call with Peter, I review their previous DSM-Q scores over time to see if Peter's self-care behaviors have been improving since we started working with them. Some of these assessments were filled out by Peter between sessions, but we have filled out a couple on our calls together. Once I initiate the call, my prompt changes automatically to guide me through all the necessary steps I must take. This was a template created in Workshop, our no-code required program editor, which we'll cover in another video, and it includes the information I need to remember for this type of appointment. On our call, we fill out a DSM-Q. A score is generated based on Peter's responses that shows they're not making progress on their behavioral change goals. Because they scored low on the DSM-Q, a high-risk diabetes care plan is automatically added to their profile. Our program director has pre-configured this template for me, and I can modify it to be tailored specifically for Peter's needs. Our dietitian, care coordinator, and I can collaborate on the various tasks that are assigned to each of us, as well as easily monitor Peter's progress with this care plan to make sure important steps don't fall through the cracks. While I have Peter on the phone, I want to confirm the time and date for our next coaching session. He mentioned that the afternoon would be better than the morning, so I'll adjust the scheduled time we have. Finally, I need to update Peter's medications. He told me he is now taking Glinase, so I add that to his information on the sidebar using Welkin's medication lookup. This sidebar is configured to hold any information that I need to have readily available for Peter. This data comes from integrations with other systems like his Bluetooth-enabled blood glucose meter, as well as manual entries like the one I just made. When I hit Call Finished, an automated process that was set up by a program director in Workshop triggers a follow-up email to Peter with a feedback survey to gauge how he feels about our appointments and ensure that we're helping him meet his goals so he'll continue on with our program. As our care team continues working with the various patients coming in, Maya, our medical director, can review the efficacy of our care and caseload management using Welkin's dashboards tailored for diabetes care. They can see patients within each phase of care, the progress of patients' various health assessment scores like the DSM-Q over their patient journey, and drop-offs in patient engagement. The customized patient profile, automated workflows, and my personalized inbox were created once by our program director in Workshop, but they can be reused across the entire care team. As we continue to learn what works best for patients in our programs, we can give that feedback to the program director so they can easily iterate and roll out updates. Over time, we know this will empower us to deliver the best patient experiences and highest standard of care.